Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Joining me in studio today are three persons from the Vector Control Services of the Ministry of Health. I have with me Mr. David Williams, the Chief Inspector, Dr. Cassandra Alonso, focal point of the AIDS Borne Disease Program, and Ms. Mohini Suklal. She is a biologist also attached to the unit. Welcome, guys.
Welcome.
So I know soon you guys will be having a fogging exercise across Guyana. And before we get into that, could you give us an overview of the vector control services, Mr. David Williams?
Okay, the vector control service that we have is to control vectors that transmit vector-borne diseases. For example, all 10 administrative regions, we have persons that conduct vector control work. And what they normally do is to ensure that these vectors that we have there, identify them and eliminate them so that it will not transmit vector-borne diseases. Some of the vectors, everybody look at that vector as an insect, but vectors that transmit vector-borne diseases are mosquito, mammal, birds, fishes, arthropod. Those are vectors that transmit vector-borne diseases, and those are the vectors that we look out for, and that is what the vector control service did. We render service to the entire Guyana to control the vector-borne diseases in the country.
Thank you, Mr. David. What are some of the responsibilities of the vector control officers?
Well, those officers will go to different parts of the region, Guyana, and they will capture, identify the vector that I mentioned before that transmit the disease, and also identify the species of vector that identify. So we have officers in different categories, whereas we have officers that will go out into the field. They will do eradication, like destroying breeding sites. We have officers that will go and capture, identifying the vector. And also we have continuous surveillance of officers that want to do continuous surveillance of the vector control service.
Okay, I know that you guys have been going out into the field for quite a number of years. What has the response been like from community members and other persons?
Well, as the years go by, we get the community involvement, which is a great impact to the vector control. We have community participation where we get persons from the community to be part of the elimination of vectors and breeding sites of the that can transmit malaria, vector-borne diseases. Also, in certain areas where there is no officers from Georgetown West who can frequently visit these areas, we train persons in those areas so that they could, that volunteer persons, that they will assist us to continue with our mandate that we have to eradicate or control the spread of vector-borne diseases and the vector they inhabit where they live in to destroy them.
So those persons are able to work within their communities?
Yes.
Okay, what are some of the methods in eliminating breeding sites?
Well, we have chemical and biological measures that we use. One, we have fogging, we have chemical measures that we use. We have chemicals that we put into the water to destroy, for example, the larva, the mosquito larva. We have, you talk about the fogging, we have fogging to kill the adult mosquito. Also, we have IRS, indoor residual spraying. Chemicals are used to spray on the wall surfaces. So whenever the vector get in contact with the wall, they will die. Also, we have the long-lasting impregnated nets that people use when if the vector get in contact with those nets, they will also die. So there's a range of um, measures that we use to eradicate or eliminate. Also, um, we destroy breeding sites. We tell the community if there's any breeding sites of vector, especially mosquito is the most prevalent vector that transmit vector-borne diseases. So we'll tell persons to um, old tires, get rid of old tires, cover drums that you're using for water, stored water. We have other part like garbage disposal and these things
Yes.
where mosquito will breed. So we encourage them and we give them tips how to get rid of those vectors.
Okay, thank you so much, Mr. Williams. We're going to go into a short break and be right back with more on vector control services.
Dengue. Dengue is a mosquito-borne and pandemic-prone viral infection prevalent in many parts of the world. Virus. Dengue is caused by a virus belonging to the Flaviviridae family, of which there are 4 distinct serotypes: dengue virus 1, dengue virus 2, dengue virus 3, and dengue virus 4. It is important to have knowledge of these serotypes because recovery from a dengue infection will provide lifelong immunity against that serotype only. Subsequent infections from other serotypes will increase the risk of developing severe disease. Transmission. The virus is spread via the bite of a mosquito, mostly by Aedes aegypti, and to a lesser extent by Aedes albopictus mosquito. Important to note here is the fact that these very same mosquitoes are involved in the spread of other viral diseases, including chikungunya and Zika. The mosquito can become infectious when it bites an infected individual. It then carries the dengue virus and injects them into another individual during its next meal. Dengue doesn't spread directly from one patient to the next. These mosquitoes can typically be found laying eggs near standing water in containers that hold water like buckets, bowls, animal dishes, and others. The incubation period of dengue is 4 to 10 days once the mosquito has bitten the individual. Symptoms. Dengue can cause a wide range of symptoms in a patient, from a subclinical disease in which the patient might be unaware of the infection, to a severe infection, in which the patient exhibits severe flu-like symptoms. The symptoms of dengue include high-grade fever around 40 degrees C or 104 Fahrenheit, along with nausea, vomiting, which is generally non-bilious, rash, aches and pains typically involving the area behind the eye, which is termed as retroorbital pain, severe headache, generalized muscle pain, and joint pains. In case of a mild encounter, the patient will recover in about a week.
Thank you for staying tuned. For those persons who've just joined the program, I'm talking to some persons from the Vector Control Services, and we're learning a little bit about what they do and the functions of their unit. Dr. Alonso, could we talk a little bit about the Aedes-borne diseases? What are some of the most prevalent diseases that are in Guyana?
So, thank you for that question. So, in Guyana, the Vector Control Services is tasked in monitoring all arboviral diseases. As you know, in the past, we were affected by, I don't know if you were, but in 2015, around 2015, we had chikungunya. In 2016, you can remember we had the Zika when we saw babies were born with, small heads than an arm, and people were panicking. And no one paid attention to dengue. Dengue was since the 1960s. But then chikungunya and Zika had this uproar. But so vector control is still tasked in monitoring these diseases. We also have other Aedes-borne diseases in Guyana. But because of the excellent vaccination service provided in Guyana for yellow fever, we do not focus much on that. But we still have an alert on it because remember we're in neighboring countries like Brazil who's still affected by yellow fever and Zika and these things. So we still monitor. So this is where we have Mr. Williams and the team will come in to monitor these areas, the ports or health ports. So my task is not just monitoring dengue is all the arboviral disease as mentioned before, but we still are affected by dengue. So the ways on how I monitor it is through surveillance. So I would normally receive data from the regions, and when I'm seeing, in certain areas, for example, for Georgetown, we would see areas such as Kitty and Sophia. We're seeing a lot of cases. I would then relay this to the entomology team, which Ms. Mohini Siklal will explain more on the entomological aspect of it. With that, she would then share it with the senior operating inspector, who would then go out and do, as he mentioned before, the surveillance aspect of it and intervention, as in what intervention we'll use to treat. Like, so if they notice that the incidents are very high, they will know what to do. You either do larval siding or adulticiding, which Mohini will explain. For dengue, as I said, we're still being affected, and ages that it's affected in both male and female. And we've been seeing a lot of cases between 25 to 44 and 45 to 64. We have a few over 60s, and we have some children are also affected. And remember, dengue is a delimitating disease, as in it once get you can it's self-limiting, as in you can recover from it if you get it. You can recover it. You have 4 serotypes. If you have like serotype 1, you can just present normal symptoms, as fever, headaches, joint pains. But what we would look out, that we still would advise persons whenever they come to the health center, or they must visit health center. I know Guyanese people, we don't like to visit health centers.
Unless there is a serious issue.
Yes. So, but whenever you notice you're presenting fever, and especially if you're living in these areas that got lots of mosquito, which is the entire Guyana, I still think you should still seek medical attention, and we advise all medical personnel normally advise patients who are affected by dengue is to other than you rest, hydrate a lot, like drink lots of water, still look for alarming signs. Alarming signs can be bleeding of the gums, bleeding from the nose for women, PV bleeding, especially if it's not the norm. If they know they're not due to have their period, but then they notice intense bleeding. So we would advise persons to look for these. Or sometimes some persons will come with rashes or petechias. It's something like black and blue marks. And so we would advise these persons to seek, because they can be going into the stage of complication. Abdominal pains, intense abdominal pains, vomiting. And because where we also advise, because they don't have a specific treatment for dengue, you treat according to the symptom. If you get a headache, we give you Panadol. Again, I'm going to stress Panadol, not ibuprofen. No NSAIDs, no ibuprofen, no aspirin, because those things, remember I explained that you can see bleeding. Those medication can provoke bleeding, right? So we advise just strictly Panadol when it comes to dengue, the treatment of dengue. And as I mentioned, there's no specific treatment. Whatever symptoms you have, if you, some persons will complain of rash and it's itching, we'll give them Piriton. They're vomiting, you give them Gravol. And again, if some persons, because remember you have fever, you can feel dehydrated, you try to give them some saline. That's if necessary, but it's a regular rest and whatever. So far we haven't been seeing much of complicated cases. They are few, and we're trying to monitor that, as in collecting this sample so that we can send it to the reference lab, so that we can then study the various serotypes of dengue we have in Guyana. As mentioned before, we have 4 serotypes. Our dengue have 4 serotypes. And I think in the past, it was monitored by Dr. Rambajan. I think he said he had found 3 serotypes. Serotypes 1, 2, and 3. They've never found 4. And I think this is a good study to do to actually know if we have all 4 serotypes in Guyana.
Thank you, Dr. Alonso. You were talking about medication and treatment. You did state that there is no specific treatment for dengue. We know that many persons like to self-medicate and they like to use a lot of home remedies. What is your views on that?
It's like everything, like people like use with it. Cucumber juice to take down the pressure, whatever, I would not personally advise, because remember, everything is like when you have medication, you have a certain amount of measurement. That's why doctors can tell you 500 milligram, you use 2 every 6 hours or whatever. When you use the normal, as we like say bush or whatever, I can't really advise it. Use 2 cups or 2 tablespoons or whatever, because it has to be measured.
Yes.
So I would strictly tell a person, just you drink your water. And it's not like, how you have COVID, everybody like to say use your vitamin C, your zinc, and your vitamin D. But I can't really advise persons, use this bush or whatever, because I remember it's not researched.
Yes.
So we deal with more evidence-based. So I would still advise persons, you have to seek medical attention from the clinics to get your medication, as in your Panadol. Again, if you see a doctor, because I think there's some error. Sometimes some clinics, I think I've received complaint that persons were diagnosed with dengue and were given ibuprofen. And as you know, as I said, it can provoke bleeding. So just seek medical attention. Hydrate is normal. You will recover within 7 days. So,
okay. For a person who would have had dengue before, could they be reinfected again?
You can be infected with dengue up to 4 times.
Up to 4 times.
And what we've noticed is, again, as you remember, I explained the 4 different serotypes. If you have serotype 1, you're living in Kitty, and then you go and live in Region 1, or you can work in some mining camp, and they would have the Aedes mosquitoes there. And in Region 1 may have serotype 2. Once infected, that is where you see more persons being provoked by complication. That's where you would more see persons with the bleeding and the bleeding of the gum, the intense abdominal pain. For labs, you may see the platelets dropping. That's when we see more complicated. But you can be infected up to 4 times.
Up to 4 times. Thank you, Dr. Alonso.
You're welcome.
So we're going to focus now on the entomology aspect. Ms. Suklal, could you tell us about some of the measures in controlling mosquito breeding sites? I know David would have mentioned some earlier, but could you expound on this?
Sure. Thank you for that question. So just a little brief about entomology is that entomology is the study of insect, and specifically medical entomology is the study of insect or vectors of medical importance. And so just a little overview of mosquito. The life cycle of the mosquito have 4 stages. There is the egg, the larva, the pupa, and the adult. Now, within those stages, you have the larva and the pupa that lives in the aquatic life. And so with that, you would find these stages in containers like your buckets, your barrels. Even the smallest cork could be a breeding site for a mosquito. So we have 3 types of mosquitoes that are of medical importance to us, and those are the Aedes, which is the black and white mosquito, which is commonly found along the coastline of Guyana. You have the Culex. This is brown in coloration. And you have the Anopheles, which is a darker blackish to brown color. So the Aedes mosquito transmits, as Dr. Alonso said, dengue, Zika, chikungunya, yellow fever. Culex mosquito transmits filaria. And the Anopheles mosquito, they would transmit malaria, which is endemic to regions 1, 7, 8, and 9. Now, when it comes to interventions, what we would use is that we have abates to which we would treat. You have the containers, we would throw abate inside, and this is a chemical called Temafos. And so some persons might saw the vector control officers in their area. These persons were treating those breeding sites. However, for us, we would treat those breeding sites, but persons might have those breeding sites to collect water for their daily use. So we would tell them, if you do have any buckets that you may not be using regularly, you can turn those down. If you have like tires, you can bore holes in those. So it's like trying to eliminate breeding sites as we go along, because mosquito, although we do fogging, and with fogging we would use the malathion. Although we do fogging, that will just kill the adult stage of the mosquito, but then you still have to do source reduction, which is to kill the aquatic stage of those mosquitoes.
Okay, with regards to some of the areas that you guys would have worked in and visited, are there any success stories coming out from there?
So what we do at entomology is that we study those mosquitoes, and so we have done a number of studies in all 10 regions. And one of the major study that we try to get ongoing is to test the resistance of these vectors to the chemicals that we use. And so while we would have found in our prior studies that there is not any resistance in some of the areas, one of our main concerns is that there is possible resistance in areas like Kitty and Ogle. So that is of a little concern for us. However, thus far, we have been working in collaboration with several agencies, locally, regionally, as well as internationally. And some of those include CARFA, environmental health. We have universities such as the Harvard University. And so we have been trying to keep these mosquitoes, to study them, to ensure that we eliminate breeding sites, as well as to decrease the number of vector-borne diseases that we have in Guyana.
Okay, how does what role does surveillance play in all this?
So surveillance is essential because, like Dr. Alonso alluded, from her data, we can be guided to set up our traps. And so we have several traps to which we set up. We have the BG Sentinel trap, we have the modified Shannon trap, and sometimes we would use human landing catches so that we can study these mosquitoes. Surveillance helps us to know whether the vector is within an area. For instance, if there is a case of dengue in Kitty, hypothetically, we would set up trap in that area so that we can monitor whether the vector that transmits dengue is within that area.
Okay, thank you so much, Mahini. We're going to go into another break and be right back.
To avoid getting dengue, our best shot is to avoid getting bitten by the mosquitoes carrying dengue. It is as simple as that. If you are a resident of or traveller to any tropical area where dengue fever is previously reported, prevention can reduce your risk of acquiring it, which includes stay in air-conditioned or well-screened housing, because the mosquitoes that carry dengue viruses are relatively more active from dawn to dusk. Wear protective clothing like a long-sleeved shirt, long pants, socks and shoes. Use mosquito repellents like permethrin to be applied to your clothing, shoes, camping gear and bed netting. And most importantly, reduce mosquito habitat. You can lower mosquito populations by eliminating habitats where they lay their eggs at least once a week and emptying and cleaning containers that hold standing water, such as planting containers, animal dishes and flower vases. Keep standing water containers covered between cleanings.
Welcome back. Mr. Williams, before we wrap up today's program, could you highlight some other diseases that are transmitted by mosquitoes?
Okay. What we have, the mosquito-borne diseases that we have are one, malaria, dengue, chikungunya, Zika, and also yellow fever. Those are mosquito-borne diseases. For the other diseases like leishmaniasis, we have the sandfly that give you a lesion or a big sore. We have the Chagas disease, sleeping. It's a bug that lives in mud or thatch roof. You mainly find these vectors in ports like in the hinterland region. Not forgetting, I forgot one, the lymphatic filariasis. People would have known that we've been going around house to house giving tablets of person for filaria. But there is a species of mosquito, a species that transmit that disease. So in Guyana we have 3 different species of mosquito-borne disease, different mosquito that transmit 3 different types of diseases, vector-borne diseases. For example, we have the Aedes mosquito that transmit Zika, dengue, chikungunya, and Zika. And we have the lymphatic filariasis that is the Culex mosquito transmit that. And we have the Anopheles mosquito transmit malaria, where we have the leishmaniasis sandfly, those that transmit a lesion, a sore. People said life sore or anything, but it's a sandfly give you that. And then we have the chagabug, the sleeping sickness. That disease also, when you get bitten, it damages your internally. We have also other diseases that vector-borne, like rodent diseases, can transmit by the urine, and these things can transmit. That will be a terrible health problem to us. So we as a vector control, we use methods to control, eliminate, and eradicate the vector from being pick up inhabitants around new breeding sites, and also control, put precautionary measures for people being infected from these diseases, especially persons that live in the hinterland region. You'll find persons come to dengue and malaria and leishmaniasis. Every region is endemic to a vector-borne diseases. For example, region 4, region 3, region 2, region 5, you'll find persons with lymphatic filariasis. You don't find nobody with no Bushia, we call leishmaniasis. But some regions, when you go in now, you're going to find that they get all 7 diseases, except for yellow fever, which we have an alert, Dr. Lanzo.
Yeah.
It's just a nearby country. It's one vector. We have the vectors living here. And if someone travel, well, mosquitoes don't have to have passport move from one place to the next, because mosquitoes go travel in bag. An infected mosquito go travel in bag. You could come from an endemic region that have vector-borne diseases, vector-borne like malaria, and you would pack your bag and you would come home. And now remember, this mosquito is infecting. You open your bag, this mosquito come out, bite some family member, and then that person becomes sick, and then you ask him, you never go in the bush, how you get sick. So those are some of the things, when we do case investigation, which is a must. We do case investigation on all our cases of vector-borne diseases, to know whether if they are indigenous, if they are imported, if they are cryptic, if they, So we do that, and to get an idea of what really we're doing. And going back to the fogging, we have advisory. Everybody everybody crying out, oh, we have a mosquito upsurge, we need fogging, we need fogging, we need fogging. Fogging only kill the adult stage, the adult mosquitoes in the area. So we have so many vectors that transmit. So we look at fogging just to kill the adult mosquito. But the mosquito, 80% of its lifetime is aquatic. It lives in these small pool water. You drink the same domestic water that you use to bathe in and everything. So if we get rid of that, which the vector control, what we do, we send out officers into the field, and they will go there and they will look for these breeding sites and eliminate that. Well, then you have no problem. But at the end, if you just cleaning, for example, a small area, you just cleaning. What about the other person outside of that area that they're not adhering? So what we're going to is to have like a penalty also for person if you can get things breed like tires, like tire shop, which we know we went to tire shops already, and to buy tires and you stand there, you can't get the purchase because the amount of mosquitoes there.
Wow.
right? So we give out advisory, and we tell the proprietors, and they say, look, if you can't come every day, we will tell them, we teach them, we give them things what to do, and that will help us to achieve our goal in eradicating vector-borne diseases.
Thank you, Mr. William. Thank you, each and every one of you, for joining me in the program today. It has been quite informative, and I want to encourage you to keep up the good work that you guys have been doing within your unit of the Ministry of Health. Thank you.
Thank you.
Thank you.
This has brought us to the end of Health Matters for this week. I'm Alicia Martin, saying goodbye for now.